Okay, so today we're talking about health insurance. This is not a scripted video, this is nothing written up. I'm just going to tell you about my latest experience with health insurance. This chair's squeaky, apologize for that. So, about 2 years ago, I bought what was essentially the most expensive plan you could buy through United Healthcare and the most expensive supplement insurance, that plan. This does not include dental or vision. This is solely for health insurance. And I wanted to have some coverage. This is on the brink of right in my middle of my high blood pressure journey. There's a few takeaways from the situation that I figured out. When I bought these healthcare plans, I'm paying about $613 a month for health insurance. That's $2,500 deductible per year. That is not a 100% 0-100 or whatever it is plan. That plan actually paid less, so this is a 80-20 plan. The maximum you could possibly get for an individual. The best one they sell on United Healthcare. And before I bought that plan, I went to healthcare.gov 2 years ago, and everybody's saying, "Oh, you gotta go here, you gotta go there." So I went and looked at the plans there, and you want to see some bad plans, you go there and look at their stuff. Most of those are also United Healthcare plans. If you are very low income, that may be the place to go. That probably is the place to go. If you're some old man like me and make, decent money, that's not for you. Your average deductible is $5,000 to $9,000. A lot of those plans, comparable to what I got now, were $700, $689 just for the primary. And then below it says recommended use co-insurance with this. They covered about half what an office visit costs. So if I bought that insurance and wanted to go, you have to buy it by December 15th. You cannot use it till January 1st. And whenever you go to use it, if you need to go to a simple doctor's appointment, which is mostly what I use my insurance for now, they pay half or less than half now, fly pester me, than what you would actually have to pay. So I think you could pay $35 per visit. Your average doctor's visit right now is about $130 to $150 for just a general doctor. If you go to a specialist, it could be as much as $350 to $400 for a specialist for one office visit. To go in there and talk to that doctor for literally 5 minutes, more than likely they'll tell you, I don't know what's going on with you, and boot you out the door, and then here comes the bill in the mail. So, long story short, I went getting off my blood pressure medicines. Been off for 4 or 5 months now, and I started getting bills in this past month. I had 2 office visits. Which is over $300. I had an X-ray of my neck, and that X-ray at my doctor's office was $581. Obviously, the insurance didn't pay that. They paid about $87 of that, and of that X-ray. And when I called them, they said there is no way any insurance company in this whole United States is going to pay $581 for an X-ray. Then the hospital's got some billing issues. I never really got the bill from the hospital, only EOB from the insurance on that. And then a whole array of little stuff come through. You got to pay somebody to read your X-ray. When I was getting off ibuprofen, I went to the doctor once. She did a blood test, figured out my iron was low, which little be known that's the side effect of blood pressure meds, is low iron. She didn't know that. The doctor didn't know that. Really nice lady. I love my doctor. She's a really nice lady. Just doing what she can do with what she's got to work with, which is not much for blood pressure. So I went back a couple months later, got the follow-up blood test. Iron levels are still a little low, but they're pretty good. And so that spawned a over $300 bill for 2 office visits. Those blood tests came trickling in at hundreds and hundreds and hundreds of dollars. So now all the smoke's cleared, and I think it was 3 office visits altogether, an X-ray, get out of here, fly, an X-ray, and 2 iron blood tests. I think I'm going to owe about $1,000 on that. Keep in mind, I'm okay with paying $613 a month if it covers stuff. So when it came down to my co-insurance, he usually pick up the rest of a doctor's visit bill or whatever's left over. When it came to x-rays or any kind of imaging or blood tests, they said, oh, no, we don't cover none of that. You're on your own on that one. Thought, well, that's cute. And that's kind of been the way. Here's what I don't understand. Everybody watching this video has health insurance, more likely somewhere or another. Or maybe you're young and you don't have it yet, and you're sliding through with no health insurance. I've done that for a long time when I was younger. Or you work at a job and get health insurance. Chances are your deductible is going to be anywhere from $4,500 to $10,000. They told me on the phone down at healthcare, the most common plan deductible that most people have in America is $10,000 deductible. And if you haven't gone to the doctor and used your insurance, you're going to find out pretty quick and pretty hard that they virtually pay nothing. And God forbid if you have to actually go to the ER. If you have to go to the ER, you might as well look all the money in your account and just say goodbye to that. Or a lot of people that will throw into a bankruptcy. They can't come up with 10 grand plus 20% after they do start paying is that could run into $50,000, $60,000. Most people don't have that kind of money nowadays. The economy is really bad. Things are really expensive. If you go on grocery shopping, you all know this. And nobody seems to have a lot of extra money laying around. Some people do, obviously, but most people do not. And a lot of you say, oh, I live in Europe and I get everything for free. Yeah, I know all about that. I know all about Europe stuff. I've been there several times. I have relatives that are the French CPS or whatever it's called. Here's the problem with that. Europe has its own problems. For one, that's running them broke, the way their healthcare plans are. And two, if you have to go to the doctor, anybody that's honest with themselves will tell you in Europe, you will have to sit in a doctor's office or a hospital literally forever before you actually get in. Most of the time, you need to go to the doctor, you're weeks or months out of getting in. Now, if you live in a small community in Europe, you may be able to go get right in. If you live anywhere close to a city, you know the wait. The wait is for real. Most of the doctors and nurses are there getting their time, their credits in, right? They work for a government hospital to get their time put in, and they're all waiting to open their own practice. What this means is the chance of you finding a doctor through government healthcare in Europe that is older than 25 is pretty slim. An average doctor in Europe working for a hospital or public practice, government practice, makes about $35,000 a year, right? Now, in Europe, you could also buy private insurance for a fair amount of money more. Most people do that there. And that's where all those doctors end up, at private practices or private hospitals. They actually have a private hospital in UK you go to. And same way in France, same way anywhere. Most people are using that. They're still paying for health insurance. And a lot of you saying, okay, this is a sore subject, so if you get offended, just click off of it, right? I don't care. When you live in Europe, you pay a large amount of unknown tax on any kind of goods, everything you buy. You go to the grocery store, you're paying 18 to 20% tax that is not really talked about. When you go buy things at the store there, you don't pay tax per se on top. It's already figured in the price, right? So if you buy something that's $100, it really should have cost $80 or pounds or euros or whatever you're paying in. And you pay that and you think, well, I got free health insurance, so I don't care. Yeah. But you're actually paying 20%, 18, 20% more. In the States, we pay, where I'm at right now, if you don't live in a major city next to an airport, we pay less than 7% sales tax on everything. And so you have to remember that's where you're paying your money at. You're paying for healthcare. You're just paying a lot more for really crappy healthcare. And let's say you made 10 grand a month and you live in Europe. You pay $2,000 just to have that crappy healthcare a month. That's how the system works. When I talk about this to people here that say, oh, Europe's the best healthcare in the world, well, those are pretty small countries, and there's not near many people in one of those little countries as there is here, obviously. We have 300, almost 400 million people. It could be way more by now. Nobody really knows that live in the United States. It just isn't the same kind of situation. So don't think that moving there is going to get you out of that. You're still going to have to pay. Now, the caveat of it is, if you're paying 20% more for everything at the store that you buy, then you got to buy private health insurance, which is around $400 a month. Depends on what you want, right? Depends on what level of plan you get. It could be anywhere from $250 to $400 a month. Then you're paying 20% plus, hundreds of dollars extra a month just to have just some mediocre health care at a private hospital. That's the way it's all set up. The only way it pays in the United States to actually have health care and is a good deal if you don't make very much money at all. When I say not very much money, you have to be well below the poverty line. I don't know what exactly the cutoff is to be able to get government assistance, but you basically got to make next to nothing, right? And the whole thing is a big mess. It's not just the United States, it's everywhere is a big mess. So what do you do to fix this problem if you live in the United States or Europe? I don't know. There's no solution yet to that. There needs to be some kind of solution brought up pretty quickly. Get off my fly. And it's a big, big problem. A lot of people know about this problem, but nobody seems to care to fix it. A lot of people's getting rich off of this problem, while the rest of it's out here are basically drowning in medical bills. And remember, I never really had any actual problems. If you have to go to the ER, where it's hundreds of thousands of dollars or millions of dollars, it could easily be getting $1 million. You'll end up with a bill that no matter how rich you are, you won't be able to pay that. You might work somewhere and I make $30 an hour. All right, well, that's cute. The hospital will take all that, every penny of that in seconds. And if you don't pay that and you own a house, they'll come after your stuff, And same way if you have relatives that go in nursing home, things like that. This isn't really a fix your healthcare insurance like this video. This is more like just kind of bringing stuff, making you aware, as almost all of you already are very aware of this. But like I said, if you have insurance at work, you haven't used yet, or you think, I got health insurance, I'm covered, I'm good. Let me tell you something, you're not. You're not. You're in for a rude awakening once you actually have to use the health insurance. And even though you think something be covered on your deductible, if your deductible is already put in, that by no means means that you will be covered at all. Because those insurance companies have a million excuses lined up not to pay for certain things. And the hospital is going to overcharge you for everything. Your doctor's office will overcharge you for everything. And to the point your insurance will not pay for it either way. And you're going to be fighting this crap forever. This is a 4-month-long battle already. For me, when I had the right insurance and did everything right, and just went to the doctor a couple times, got an iron test twice, and got an x-ray of my neck because my neck was hurting. And this is where I'm at with this, right? Very annoying, very frustrating. When you call the hospital, nobody gives a rat's ass. The lady, if you call there, whoever gets on the phone is going to be just some peon that doesn't care. All they want to do is get you off the phone. That's all. when they sell you a health insurance plan, your insurance sells you a health insurance plan. They'll tell you whatever it takes to get you to buy that plan. You quickly figure out that it basically covers nothing. You say, well, you need to get Blue Cross, you need to get Humana. A Blue Cross Blue Shield plan for what I have right now will be about $1,700 a month. And some people will be like, oh, it covers more. Well, it better cover more. $1,700 a month. What is $1,700 a month? That's a $500,000 house, $600,000 house, if interest rates were somewhat normal, and maybe more, depends on what the rates were. Interesting. Everybody watch out for this. This is a big, big problem. Hope you liked the video. Just trying to bring some awareness to everybody. Not trying to scam you out of money, not trying to do this or do that. Just trying to help everybody watching the video. Leave a comment below if you had a health insurance problem. Make it short as possible so everybody can see it. And I'm curious to see if other people have had this problem or it's just me. Thanks for watching. Have a good day.